is this really as big a deal as it's being made out to be? So I just want to share my perspective as a physician and as a Christian about this virus. So many of us do remember the H1N1 flu pandemic of 2009. So I'm going to use that as a starting point and for some comparisons. There are a lot of similarities in several ways between COVID-19 and H1N1 flu. Again, H1N1 flu caused a pandemic in 2009. They're probably roughly similarly infectious, although COVID-19 may be a little more infectious. In 2009, H1N1 was a new virus and nobody had any immunity to it, so it was able to spread rapidly. But there are some pretty big differences beyond those surface level similarity. Probably the most important difference is that the mortality rate of COVID-19 is about 10 times that of flu viruses. You'll see different estimates, and it's very hard to get an exact calculation on it, but let's say conservatively that the mortality rate of COVID-19 is about 1% of infected cases will die, and that compares with about 0.1% of cases of flu, including H1N1, will die. So there would be 10 times the number of deaths among the same number of people infected by COVID-19 and H1N1 or other flu viruses. If you have ever been in a hospital during a busy flu season, let's say at the peak of flu season, then it just looks bad. Everybody's stressed out. Everybody's running around. There are patients waiting on stretchers in hallways. There are a lot of patients being held in emergency rooms that belong in intensive care units, but all the intensive care unit beds are full. And also when we talk about deaths, we're not talking about something that just suddenly, people don't usually just suddenly die. They become critically ill and there's a fight for their life that's eventually lost. And so you realize that 10 times the number of deaths in the same period of time will completely overwhelm our hospitals and every aspect of healthcare in the United States. So the mortality rate is the biggest driver. Several of the things being fairly similar, this mortality rate is going to drive tremendous stress on our healthcare system. And the more people that get sick at once, the more people will die because there's less capacity to care for them. I've heard some people think a little bit complacently about the capacity of the healthcare system, comparing our healthcare system to Italy's, but I can tell you we just do not have the surge capacity to handle something that is 10 times as deadly as a flu season. There's another significant difference, and how big of a difference this is might be debatable, but H1N1 flu was and by and large is treatable with antiviral medications, including Tamiflu, whereas COVID-19 has no known effective antiviral treatment. So Tamiflu reduces the severity and duration of the flu when treatment is started early, and in some it may reduce the risk of complications and death, but we have absolutely no similar treatment for coronaviruses such as COVID-19. And so the only things that we have are what's known as symptomatic or supportive care. So if you have fever, we treat with Tylenol. If oxygen levels drop, then we can give oxygen. If the lungs fail, we can put a patient on life support with a ventilator, but we don't have anything that's really specific against the virus like we do with the flu. The third big difference that I would highlight for this is the prospects for a vaccine. So with influenza, we have systems and long experience to create new, safe, and effective vaccines every year to match new strains that are projected to be the most prevalent flu strains for that year. And that existing expertise was really rapidly leveraged to create a vaccine against H1N1 influenza in 2009, and that vaccine was mass-produced, licensed, and made available for public use just about to the day, 5 months after the new virus was detected. And so by contrast with that, there has never yet been a single coronavirus vaccine that has been shown to be safe and effective in human trials. There have been some potential candidates that were close to that point, but funding kind of dried up as interest in SARS fell over the past few years. At least one team working on a vaccine right now is actually planning to skip animal trials altogether, going directly to humans, whereas normally animal trials are done first to get some initial evidence of safety and effectiveness. And so it's already been 4 months since COVID-19 was discovered. At 5 months into H1N1, we had a mass-produced licensed vaccine. And right now, it's impossible to say when a vaccine is going to be available. But it could be months or possibly even years away. I read again about a British team that's hoping to do human trials starting in June. It's impossible to say how far we are away from having a vaccine. What should we do and what can be done? I think the first thing is to reckon with the reality that this is going to be very difficult. And the virus is now spreading in communities in the United States. It is no longer possible to contain it. So its spread is pretty much inevitable. It is probably eventually going to infect between 60 and 80% of our population. So we're not going to stop this virus. And so now you're hearing the words slowing, flattening the curve, mitigating. Am I saying we should all panic? And I'm not at all, absolutely not. Should we panic? There are some rational things we can do to help the situation, but obviously some people have panicked. And how do you know somebody's panicked? And basically when you see people doing irrational things, that's a manifestation of panic. So we're definitely seeing that. When you see the most obvious example we've all encountered is seeing folks buy up all the toilet paper. And so we have an artificial shortage of toilet paper because of that. Another irrational thing that people are doing is buying all the masks they can find and wearing them in public. That's irrational because not only does it not help you to keep from getting the virus, but it actually hurts those of us in healthcare who use those masks on a daily basis for our normal operations. And we're now having trouble getting masks for our use because of the shortage. So if we shouldn't panic, what should we do? What we should do are the things that we know will help to slow the spread of the virus. And so far in America, we're not doing a good job of this. The measures that have just been taken by emergency declarations in the state of Louisiana and in other states may begin to have some more effect. But I looked this morning at the time it has taken for cases of COVID-19 to double in Italy over the past 2 weeks. And their doubling time has been a little about 3.5 days. And our doubling time so far in America has been just a little over 2 days. So we're actually, although our number of cases is not that much yet, when you have exponential growth that's doubling just a little over every 2 days, it won't take long for it to become very, very massive. Again, the goal of slowing down the spread of COVID-19 is to have fewer cases at any one point in time so that our healthcare system is less overwhelmed. And so we can provide better care for those who are sick. And that's the goal. We won't have fewer total cases in the long run. And I think that it's important to realize that. All the measures that are being taken today will not reduce the total number of cases that will eventually occur. The goal is to slow it down, to keep the caseload at any one time lower. In Italy, right now, especially in northern Italy, doctors are having to make wartime-like decisions, terrible decisions to choose which patients they can treat and which ones they simply can't because they don't have the people, space, equipment, and other resources to treat them. So we want to reduce the need for doctors here to make those kind of decisions. How do we slow it down? We slow it down by reducing the possible ways for us to get the virus, by keeping physical distance from people, and by killing the virus either on our hands or on surfaces that we touch with our hands. So it's social distance, hand washing, and surface decontamination, and that's pretty much it. You might think that wearing a mask will reduce your risk, but that is actually really just wishful thinking. You are breathing air that's coming in the sides of the mask. The mask is basically useless to keep you from getting the virus. I'll say parenthetically that if someone knows they have COVID-19, first of all, they should be isolating themselves. Second of all, if there is a need for them to be around someone for hopefully short periods of time, then in that case, wearing a mask might reduce their chance of spreading it to others. So that is the case where a mask might be helpful. And how that works is when you cough or sneeze with a mask on, most of the droplets are basically trapped right in the mask. Now, obviously, some of them still can shoot out the sides of the mask. but a much greater proportion of them are going to shoot into the mask on a cough or sneeze than any protection you might get by breathing in when most of the air is coming in through the sides of the mask. So keeping physical distance from people, since the virus is transmitted mostly by droplets that travel no more than a few feet from the infected individual, and washing your hands in case you picked it up from someone else's hands or from a surface, and then disinfecting surfaces that may have been touched by other people, and again, washing your hands after you touch strange surfaces. So that's pretty much it. So the social distance and the benefit of social distancing is the rationale for the closure of schools. That may be a little bit of a two-edged sword, because then there's a tremendous hardship and burden that people have to deal with caring for their children and trying to do it in ways that don't then return them to the same level of risk that they might have been in school. But at least they're, even when there's child care arrangements with friends and so on, then people will be in smaller groups and less likely to rapidly spread a virus through a very large number of people at one time. By the way, the time to slow it down is before it starts spreading like wildfire. Once it really takes off, then it's too late, because it's almost impossible to slow it down once it gets to a certain point. To some, the steps our government is taking, for example, here in Louisiana by declaring an emergency and closing schools, seems like an overreaction because we haven't seen cases, any cases in our part of the state yet. But it's really the right time to do it, because it has to be done before they really take off to that extent. And I saw a quote, I can't attribute it properly. During a pandemic, what's done before the pandemic really gets going will seem like too much, and after the pandemic gets going, everything that was done will seem too little. You already know this, but some people are at especially high risk for dying if they get this virus. So that includes people over age 60, but also anybody with any chronic health condition at any age. And so those include things like diabetes, heart disease, chronic lung disease, suppressed immune systems. Suppressed immune system includes people on medications for cancer and autoimmune diseases. So people with these risk factors should especially do what they can to reduce their potential exposure to the virus. In practical terms, that may mean having a friend, neighbor, or family member do grocery shopping or running other errands for people in these conditions who don't feel safe getting out into the public. And the last thing that I want to emphasize is that although our governor's emergency order was for 30 days, we are likely to see this continue for a matter of months and not weeks. And it's most likely that cases will continue to ramp up, probably at least over the next 2 or 3 months. And this is just a simple consequence of the mathematics of multiplication and how far it has to get before it begins to slow down naturally because of herd immunity in the population. And I want to say, if we see cases rise in our community here in central Louisiana slowly, we should not be discouraged that these measures are not necessary. We should be encouraged that the measures we've taken are working. And we'll be able to watch, anybody can watch this doubling time, just watch the statistics and watch how long it takes for cases to double in any given locale that you want to look at. So if our doubling time is a little over 2 days, then we're not doing nearly enough. So basically, if things seem to go slowly, take heart and be persistent in the measures that we talked about: social distance, hand washing, and surface disinfection.